Cancer sucks, but is keto the cure? Are ketogenic diets a true hope for people with cancer, or are they just hype? I'm going to get to the bottom of this with you today. So, you may have heard about this idea that if you starve a tumor of its glucose, you're actually going to kill the tumor. And you can do this through ketogenic diets. So, I want you to ask yourself, if you or someone you love has a cancer diagnosis, first of all, I'm sorry to hear that, but I hope this presentation can help you with some information that's relevant. Many people are in a situation where they're deciding what to do after they find out that they have some kind of cancer diagnosis that requires treatment. And they may be considering surgery, chemotherapy, radiation, or one of these other alternative methods, such as a ketogenic diet, which maybe they heard is an alternative or some kind of option to help them fight this cancer. This can be a life-changing decision. And personally, I've helped somebody in this situation recently, and I was inspired to make this video so I could help more people. So I hope it can help you or someone you love. I want to tell you that in summary, there's a lot of hype out there. There's some hope, but it's not going to be in the way you might have expected it. So let's go through some of this research together and get to the bottom of it, okay? I'm Dr. Omar, and welcome to Medical Wisdom. I'm trying to answer all of your questions and try to help you feel empowered with your choices regarding your health. And as a reminder, this is just educational information, not personalized medical advice. So what does ketogenic actually mean? Most people have tried a ketogenic diet here and there, but technically, if we're talking about a therapeutic ketogenic diet for cancer, we're talking about something on the order of 2 to 4% of calories as carbohydrates. Sometimes this can be as little as 10 to 15 carbs per day. Moderate amounts of protein. So protein macro composition will be around 16 to 18%, and a very high percentage of fat, 80 to 85%. Now, the reason why people are interested in the ketogenic diet for cancer is because of something called the Warburg effect. And the Warburg effect is the basis behind why restricting glucose could be relevant to cancer. And it's named after this biologist from many decades ago. The idea is that some cancers really are dependent on glucose in order for them to survive because of the way they divide. And even with oxygen, they still are favoring this glucose pathway for their metabolism. So if you can somehow cut off that glucose pathway, maybe you can keep the person alive by killing the cancer. So a ketogenic diet shifts metabolism away from glucose, away from sugars, towards ketones. So that might be a strategy. And again, the idea is to kill the cancer and keep the person alive. The way this is thought to work is that the ketogenic diet does lower insulin, glucose, and something called IGF-1. And these molecules are related to cell division and cell growth. So in principle, it's a great idea. Second, when you're in ketosis, you have a higher level of this molecule called BHB, beta hydroxybutyrate. That's one of the ketones that goes up. And we know that when you have this pattern, the metabolism of the tumor and the host are going to change. And they're going to be in the direction of burning fat and not burning glucose. So what this could be doing is cutting off the supply to the tumor, but also making the therapy that somebody's getting more sensitive to. That's another possible mechanism. Maybe the chemotherapy or other therapies are more likely to work because somebody's in ketosis. We don't really know. But what really matters is when you have a loved one that's struggling with cancer, it's human evidence. Yes, there could be all these non-human animal studies in mice and rats and fruit flies or whatever, but in the end, we really can't make a generalization unless it's a human study. So I'm going to not really focus on the non-human animal studies because they're very hard to replicate in humans, and therefore they're very hard to interpret. So we have to draw the line at human studies. So the first one I'm going to go over with you is a lesson on why non-human studies are difficult to interpret. So this is a study done in non-human animals. I believe it was mice, showing that the ketogenic diet enhances the anti-cancer effects of another intervention. So this would be keto improving outcomes by making the cancer drug more effective. So that's great news, but it's in a non-human animal. So can we generalize it? Another study here shows that being in ketosis actually promotes cancer metastasis or cancer spreading. And that's not a good thing. Who wants to have metastasis or spreading of cancer? And this is in a non-human animal study. Can't really generalize. Again, here's another study showing the ketogenic diet triggering metastasis, triggering tumor spreading. So that's why I'm not going to go over the hundreds of studies in mice, but you probably will hear about a lot of these studies. It's very promising in this animal model. We were able to kill all the cancer by putting the mouse on a ketogenic diet. I just wanted to show you that there's conflicting data there. It's hard to interpret. Now let's look at the actual human studies. Here's a systematic review, and why it's important is because systematic reviews allow us to look at multiple studies at once. So it's summarizing a bunch of other studies on the impact of a ketogenic diet on cancer outcomes in humans. So the reason this is important is because it's a study of studies. It's like more important than a single study. And what did they find? Across all these studies, the ketogenic diet, or KD, you definitely are going to have reduced fat mass, which makes sense because that's why people do keto diets. They lose fat, although it's hard to sustain and not really sustainable for most people long term. People also lose visceral fat, which is a dangerous fat that predicts a lot of heart disease, stroke, some cancers, and people's insulin and glucose levels go down. So this is all kind of expected stuff, nothing surprising here. But one benefit was people had less fatigue and less insomnia. So that's more of a quality of life benefit. But these quality of life domains are not really what people are looking for. They're looking for living longer, and they're looking to beat the cancer so they don't die. So unfortunately, the survival impact has not been proven. When you look at the current level of meta-analysis, or the highest level of studies on ketogenic diets and cancer survival, we don't really see benefit at this point. Unfortunately, maybe one day in the future, but not right now. Here is a couple of more smaller studies that are relevant. So this is a breast cancer randomized controlled trial, and they looked at whether the ketogenic diet improves quality of life, physical activity, and other biomarkers. And what they found is that, yes, during the chemotherapy, people were already getting chemotherapy. They added on ketogenic diet. People had better quality of life at 6 weeks, but at 12 weeks, there was no difference in the quality of life of people. So again, we have mixed evidence here. A second study here is also on breast cancer patients, randomized controlled trial, very approach to studying questions. What we found is that also 12 weeks later, same kind of approach, something more promising, tumor size reduction was greater in the ketogenic wing of the study. So 6 millimeters over 12 weeks. So that's good. But there was no benefit in the metastatic response rate. So there was no benefit in whether those spreading of the cancer responded to the treatment and the survival as well. And again, even this change in tumor size reduction from the ketogenic diet has received a lot of critiques in terms of the methods of the study. Maybe it was an artifact of some other way that the study was done. So even this very promising study is not particularly showing much difference in metastatic response rates or survival, and even the benefit for the tumor size reduction is questioned. So those are two pretty good studies with, not such amazing results. But I wanted to also mention that the way you could summarize a lot of these studies, these smaller studies, is that in general, the good news is that a ketogenic diet is fairly feasible in cancer, meaning some people are able to implement it into their lives, and that's great. And we also will see definite benefits for metabolism, quality of life. Insulin goes down, glucose levels become moderated, people will lose weight. But again, no randomized controlled trials really showing long-term survival benefits yet. So there is definitely this internet hype. You see even books written about this. It's well beyond the level of evidence that a doctor could responsibly recommend. So it's just not there yet, unfortunately. Maybe one day in the future will be. Right now, I don't think it's responsible for a doctor to say, hey, ketogenic diets are going to extend your life significantly. Nonetheless, I think there is a place for people to consider a ketogenic diet right now. So if someone's really motivated, because it does take a lot to stick with, that's the first thing. You have to be really motivated. The second thing is oftentimes when people have cancer, they're going to lose a lot of weight because of the metabolic changes from the cancer. So the cancer itself is going to cause people to lose weight. The cancer might be burning its own calories. So sometimes people are needing to gain weight, and going on a ketogenic diet can be dangerous for that person. Also, you might want to consider this if you're in a clinical trial, because that's a safe place where people can monitor you with a nutritionist. You don't really want to do this on your own without monitoring. And you want to consider with your doctor how this kind of intervention would integrate with standard of care. So is ketogenic diets going to be added on to your standard of care? Is it going to be a replacement for standard of care? Is it not going to be used at all? Those are all decisions you want to make with your doctor. But I would say you want to avoid or be careful in general, not talking about anyone in particular, but in general, I would say you got to be really careful if you have this problem with weight loss. or if you have type 1 diabetes, because type 1 diabetes is not a good thing to mix with ketogenesis because there's a problem with ketones in type 1 diabetes and weight loss as well. And then finally, kidney stones. Well, we know that ketogenic diets can induce kidney stones, so you don't want to mess with that. And also with pregnancy and lactation, it's definitely not good to be on a ketogenic diet when you have cancer as well. And pancreatitis is also a problem, advanced liver disease, because there can be changes in the bile system and the way the pancreas is working. And that can definitely cause a lot of side effects. Finally, the biggest challenge for a lot of people when they're going through cancer is maintaining adequate intake, adequate calories and protein specifically. So people in those situations should not be considering ketogenic diets. So if you're someone who wants to try this, I would say you should have a nutritionist supervising you, preferably in an oncology department. And protein should be above 1.0 grams per kilogram per day. So if you're 220 pounds, that's 100 kilograms. So you're looking at 100 grams of protein per day. And remember, your body cannot really absorb more than 40 grams of protein in one meal. So you'd want to divide that up throughout the day. Also, adequate calories are really important, 25 to 30 kilocalories or calories per kilogram per day. So for a 100 kilogram person, that's going to be around 2,500 calories per day in order to maintain your weight with that cancer, as well as protecting lean mass. And the way you can do that was with adequate protein intake and movement. But when you go on a ketogenic diet, you also have to worry about lipids, hydration, electrolytes. Lipids, because if you're eating a lot of saturated fat, your lipids can get thrown off. Hydration, because sometimes people don't maintain the level of hydration they need. The constipation is an issue on ketogenic diets. And of course, electrolytes can change. So that can mess up your heart and other things. So it's really important to monitor yourself regularly under supervision. I want to come back to this kidney stone risk because people often ignore this when they're on ketogenic diets. It's a real risk. The overall incidence is about 6% when people are on a ketogenic diet overall. And this is much higher than the general population. So in adults, it's about 7.9%. It's not a small number. We know that if there's kids who have epilepsy who go on ketogenic diets to treat their epilepsy, which is very much different than for cancer because that intervention has a lot of evidence for it. So it's more of an evidence-based recommendation compared to the cancer treatment with ketogenic diets. And over there, they take potassium citrate before to reduce their kidney stones. So that's something that if someone is trying to avoid kidney stones, they can talk to their doctor about. And these are difficult discussions to have and understand, but I hope this has been helpful for people. But overall, I want everyone to know that at this stage of the research, I think ketogenic diets can be thought of as an adjunct in some cases, not for everyone, but certainly not a cure. It can shift your metabolism. It can improve quality of life for some people. It can improve the insulin and obesity related biomarkers. But I think this is what's really important. There's really no randomized controlled trials or meta-analysis showing ketogenic diets are going to improve longevity or decrease mortality in patients with cancer, and especially with advanced cancers beyond stage 1. So I think it's really important not to just think of ketogenic diets as an alternative to standard of care. If someone's going to do it, they should think about it within a clinical trial using dietitian oversight, and it should be individualized based on cancer type, body composition, and the goals. But overall, I just want to leave you with this idea, which is that at this point, it's not responsible to say that somebody should ignore standard of care. Surgery, chemotherapy, and radiation are the standard of care, depending on your cancer. Under no circumstance would I recommend somebody to just do a ketogenic diet and ignore all of those standard interventions, which, depending on the cancer, can increase lifespan and can decrease mortality. So if I've been able to get that point across, that's the one thing I want you to remember from this. Think of ketogenic diets as an adjunct, possibly, depending on your situation, but not a replacement for standard of care, not a replacement for surgery, chemotherapy, and radiation, which we know have been studied much longer and more extensively and can actually, in some cases, increase lifespan and reduce mortality. I hope you found this helpful. If you or someone you know is struggling with cancer, I hope this has helped you understand ketogenic diets better in this situation. Feel free to pass this along to someone you love who's struggling. And I wish you all well in your treatment course. Take care.